A presidential health threat on a historic level.
A walk that no doubt the president did not want to take as part of his presidency.
The commander-in-chief airlifted to Walter Reed hours after a confirmed case of COVID-19. Now the treatment, the timeline, and who else has tested positive tonight. Plus an optimistic outlook from the president himself.
I think I'm doing very well, but we're going to make sure that things work out.
Good evening. I'm Maurice Dubois.
And I'm Christine Johnson. Right now, here are live pictures outside Walter Reed Medical Center in Bethesda, Maryland, where President Trump will spend the night as the world waits for word on the most serious presidential health crisis since the attempt on Ronald Reagan's life in 1981.
Also, some late breaking news tonight. Minutes ago, we learned that former White House counselor Kellyanne Conway has also tested positive for the virus.
The list of those infected is growing, and this story is constantly changing. We have team coverage tonight for you that begins with Dick Brennan here in studio with the very latest. Dick?
Well, Christina Maurice, the president's physician says he has mild symptoms of coronavirus and is recovering from fatigue. But CBS News has learned the president also has had a low-grade fever while the first lady remains in the White House with a mild case. All this after the president's chief aide, Hope Hicks, tested positive yesterday. The president showed no physical signs of trouble as he walked to Marine One on the White House lawn, this time wearing a mask. Before he left, he tweeted a video message.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out.
Mr. Trump is 74 years old and would be considered to be in a high-risk group. The White House says he's hospitalized out of an abundance of caution.
The odds are that he should survive this. He should recover. But one thing we know about the coronavirus, the one thing that's predictable about coronavirus is that it's unpredictable.
Vice President Pence, next in line to the presidency, has tested negative, as has Joe Biden, who debated the president in Ohio Tuesday night. He's pulled negative ads for now, sent well wishes to the president and first lady, but also focused on wearing masks.
It's not about being a tough guy. It's about doing your part.
The White House medical staff is trying to find anyone who may have had contact with the president after a whirlwind week of events that took him to 5 different states in 6 days from multiple events. It's not clear when the president was infected, but it could stretch all the way back to a Rose Garden event last Saturday for his Supreme Court nominee,
Judge Amy Coney Barrett.
Now, at least 7 people there have contracted the virus. Beside the president, first lady, and Hope Hicks, we've now learned that Kellyanne Conway has tested positive, along with Senator Mike Lee of Utah, Senator Thom Tillis of North Carolina, and Notre Dame President John Jenkins. And there are questions about the timeline of events this week. Hicks tested positive Thursday, but despite knowing this, the president was allowed to fly to his New Jersey golf club, holding a fundraiser with dozens of donors, some who say the president seemed hoarse and lethargic.
He socially distanced. It was an outdoor event, and it was deemed safe.
Thursday night, the president delivered a recorded speech at the annual Al Smith dinner.
I just want to say that the end of the pandemic is in sight.
Now, at Walter Reed, the president is not staying in a simple room. It's more like a wing to the hospital. It has its own ICU, a secure conference room, an office for his chief of staff, and a place where his physician can stay 24/7. Mr. Trump could be there for a few days. Christina Maurice.
Okay, Dick, thank you.